Hi, my name is Sarah Dunbar. I'm the 7th and 8th grade science teacher at Mount Desert Elementary School in Northeast Harbor. Personally, I've been involved with the MDI Biological Laboratories All About Arsenic project since 2015. My students here at MDES have participated in the SEPA-funded project for the last 2 years. This project has allowed my students to learn about the public health concerns of arsenic in well water, but also given them the opportunity to work with real and relevant data. We have learned so much about why this is an issue in Maine, and we are happy to be here today to see this bill coming to the Health and Human Services Committee. This bill would be a great step forward in providing safe drinking water for Maine residents. With me today are a few of my students who are eager to share their views as to why this bill should move forward. Thank you for this opportunity, and I will let Phoebe and Sunny start.
Dear Senator Claxton, Representative Mayor, and Health and Human Services Committee, thank you for the chance to present to you today. My name is Phoebe Dunbar.
And I'm Seneca Haney.
We're students at Mount Desert Elementary School, and we feel it is necessary to let you know about the issue of arsenic in our state. As you know, the bill LD 1570 is working on being passed. It will make it so the max contaminant level in Maine changes from 10 to 5 parts per billion. The bill also makes it so people who are renting their houses must disclose the results of well water testing to their renters. Earlier this year, we participated in the All About Arsenic project. This project is a SEPA-funded project through the MDI Biological Laboratory. This includes providing well water samples to people in our community. We learned about arsenic and did a classroom investigation on the impact of arsenic on lettuce seed. This project made us understand how important it is to test your well water regularly and make sure you have a low level of arsenic. The expense of an arsenic test can vary from $30 to $150. For low-income families, this could be difficult. If this bill were to be passed, it would provide free well water testing to low-income families. We feel this is so important to help and protect the Maine residents from the harmful effects from arsenic.
Contaminated water used for drinking, food preparation, and irrigation of food crops poses a great threat to public health from arsenic. Long-term exposure from arsenic drinking water and food can cause many forms of cancer, including skin, bladder, kidney, liver, and lung, while having high dosage can lead to skin lesions. Part of All About Arsenic project is to provide well water tests to community members. We have spent time analyzing the data we found, and 20 submitted well water tests fall between the range of 5 parts per billion and 10 parts per billion. That's over 9% of the wells tested in Maine. So those people that think their well water is safe, but in reality, any arsenic in well water is harmful. It bothers us that there are so many people that think their well water is healthy, but in actuality, any arsenic is not safe to drink. According to Healthline, through drinking water, more than 200 million people globally are exposed to higher than safe levels of arsenic. By lowering the max contaminant level, we are helping to protect our residents from very severe health issues. We urge you to move this bill forward so less people are exposed to arsenic. Thank you for your time. Sincerely, Seneca Haney.
And Phoebe Dunbar. Next to speak is Cecilia Whitehead.
Dear Senator Claxton, Representative Mayor, and Health and Human Services Committee, thank you for letting us speak today. Our names are Cecilia Whitehead.
And I'm Colissa.
We've been doing research on arsenic, and this year we researched the health effects of arsenic and what a homeowner can do if their arsenic levels are high. We also did a class investigation seeing how arsenic impacted lettuce seeds. We have learned a lot about arsenic, and we want to share with you why this bill is so important. Right now, the bill known as LD 1570 is trying to be passed to lower the max contaminant level of arsenic in Maine from 10 parts per billion to 5 parts per billion. The reason why it's a big problem is because even when people have a low level of arsenic, they can still have serious health issues. What the most scary thing about arsenic is that it's odorless, colorless, and tasteless, so you don't even know it's in your drinking water unless you get a test.
LD 1570 also includes actions about landlord disclosure, meaning that when you rent a property, your landlord must tell you if the property you are renting has arsenic in the water, which is very important to the bill because that could save lives. The other part of the bill is lowering the max contaminant level. The people want to lower the arsenic levels so they are not at risk in a state where over half the population uses well water to drink and cook food. 1 in 6 wells have been called unsafe, which is leaving 100,000 children and adults at risk.
If LD 1570 were to be passed, there would be lower chances of people getting cancer and other health risks because the max contaminant level would be 5 parts per billion, which is half, so people would get filters for their water to be safer if they had under 10 parts per billion, because lots of people now have arsenic levels that are under 10, but they think they're fine, but they could still get sick.
All these reasons are why we believe that we should pass LD 1570 to lower the max contaminant level of arsenic in Maine's well water. We are very concerned about this issue, which is why we hope the LD 1570 bill will be passed. Arsenic can affect you for your whole lifetime, beginning with arsenic exposure. Arsenic in people's water can cause some cancer like bladder cancer, skin cancer, and lung cancer. All of these can happen with low doses exposure over a long period. Can you imagine how you would feel if somebody close to you was exposed to arsenic and you didn't know what was happening to them? Because I know I would feel off. Thank you for your time.